I'm Michele Crosmer here with Dr. Hashmi. How you doing, Dr. Hashmi?
Oh, I'm well. I'm well. How are you, Michelle?
I'm doing pretty good. This is our second live that we're doing with plant-based kidney health. Our last one was kind of a test. We did a little bit more frequently asked questions for kidney disease, but this time we got a lot of questions um,
We
that we
got a
want to
lot
dive.
of questions. Yes.
Yes. Anyone who is joining this live with us in the comment box, you can go ahead and ask any questions that you have, and then we'll get started in the meantime with some of the questions that people asked ahead of time. So, thank you guys for joining. Let's dive right in since there's a lot of them. So, this person's question, they said that their urologist recommended that they should be drinking 3 liters of water a day to prevent kidney stones, but they also have stage 3B of kidney disease, and they thought that drinking too much water was then bad. So, what do they do?
So this was interesting. There was a comment on one of the other videos, and somebody said, they said, I wish doctors would just get together and kind of straighten out the facts they say because it's so confusing because one doctor says one thing and another doctor says another thing. So let me clarify. It's not that doctors say different things. It's that sometimes we're only hearing part of the answer. So let's explain that a little bit. So when we talk about drinking water for kidney stones, what we are referring to specifically is if we look at two examples, we have a pond and we have a stream. When we look at a pond where water sits around, when water sits around, debris can actually start to collect together. And when debris starts to collect together, it forms particles, and those particles are what essentially forms kidney stones. Now, when there's a stream, it's much harder for those particles to stick together and form kidney stones. That's the whole idea. So, what the research shows is that the more water you drink on a regular basis, so in other words, you can't just drink all 3 liters at once. If you drink water throughout the day and you create a stream effect, you're going to reduce the odds, not 100%, but you're going to reduce the odds that debris is going to collect, and as a result, it's going to be unable to form kidney stones. Now, what the heck does that have to do with the idea of water intoxication or dying or hyponatremia? There's this idea that if you drink too much water, you can actually die from it. That's absolutely correct. So, how do these two statements of drinking water to prevent kidney stones versus water intoxication make sense? So when we look at our kidneys, it's really important to understand that kidneys have the ability to be able to get rid of water at roughly about the rate of about a liter, essentially an hour. So the exact number is anywhere between zero point 0.8 or 800 milliliters to 1 liter per hour. Why should you care? Because if you drank all 3 liters at once, you could dilute your salt content. And if you drop your salt content very low, specifically less than about 120, even more so less than 115, you can get seizures, coma, and death. So, what's the message here? If you're going to drink those 3 liters, you want to spread that throughout your day. Now, how do you know if you are somebody who can drink 3 liters if you have advanced kidney disease? The way that you have to understand is, are you somebody that when you're drinking water, you start to get swelling, you start to have shortness of breath? Your cardiologist is saying, look, you're getting fluid that's trapped inside your lungs. Those are all things. So you have to work very closely with your interdisciplinary team. But the bottom line here is when you're talking about fluid, it's the rate at which you drink, not so much the total volume. The rate is very important. And then the total volume over 24 hours is what we're talking about for things like stone prevention.
Yeah, and that definitely gets complicated, right? We have both kidney stones and kidney disease, but I think that's important. Yes, that hydration is important for preventing kidney stones. It's not that high water intake's bad for people with kidney disease. It's just if someone with kidney disease then has swelling, shortness of breath, usually these things happen in later stages, or fluid retention. They're not urinating the same. That's where too much water might start to add up and be a problem. Okay, let's get to some of these live questions. Someone says, is dairy problematic for kidney disease because saturated fat is bad, or for health overall, or does it affect the kidney directly? Um, so that's a very complex topic. I will say one thing is we do have an entire episode that is dedicated to dairy and kidney disease. And at least, and I'll have you chime in too, Dr. Hashmi, but from a standpoint of dairy, it's complicated because research kind of says different things. So, what we're looking at from a dietary standpoint, yes, dairy is a source of saturated fat. If it's cheese, it can be very high in sodium, it could be high in phosphorus, um, and it's a source of animal protein. So, I would say from that standpoint, generally, those are the concerns or things to think about with dairy and kidney disease. From a standpoint, we look at the potential renal acid load of things. Dairy is not as high of a potential renal acid load as like meat or other animal proteins, but it's not as low as like our fruits and veggies and whole plant foods. So, at least from my standpoint, and we do have a question on this later on that we'll get to, is it's not one thing for any for like every single specific person. It might be inflammatory for one person. It might lead to too much salt, too much saturated fat, too much animal protein or phosphorus for another person. But it's not any one thing with dairy and kidney disease. Dr. Hashmi, anything you want to add to that?
Yeah, so when you look at the previous videos we did, we talked about all the research that's been published on this. And what the research talks about is in earlier stages of kidney disease, eating things like low-fat dairy was shown to be protective. And then as you got into the later stages of kidney disease, eating things like dairy, whether it was low-fat or high-fat, in both cases was shown to actually accelerate the rate of kidney function decline. And part of the reason for the later phases of kidney disease is because of the fact that there's phosphorus, because of things like IGF-1 protect possibility going on as far as that goes. And there may be other things. So phosphorus plays a role, other things may play a role. But what we don't know is what makes it protective earlier on in the phase. So all of the research, when it talks about things like animal-based versus plant-based, they don't put dairy in the animal-based category because what they find is that dairy ends up having protective roles, and so they either exclude them out of the studies or they end up including them in more of the plant-based variety. So therefore, the overall recommendation is always the same. Is what we always talk about is a plant focused approach. Instead of thinking about this is purely evil or purely good, 80% of the benefit that you're going to get in life is starting to make those bigger changes. What are those bigger changes? The processed foods that you're talking about, the red meats that you're talking about. If you start to focus there, the fact that you're not moving, get off the couch, the fact that you're not sleeping, sleep more, move more, practice gratitude and kindness, eat more plants. If you start there, you will get 80% of the benefit.
Yeah. Um, okay, so another question someone said, they said they're doing everything to get protein out of their urine. Um, but their creatinine's not coming down, their GFR. Yeah, so basically they're doing everything that they can to get protein down and creatinine down, but they don't feel like anything's working. What would you say to that, Dr. Hashmi?
So I think there's a lot of misnomers out there, and there's a lot of folks even on the internet that make it seem like the goal is to make the creatinine come down, or to make it seem like I got my kidneys from a stage 4 to a stage 1. Look, when I have a cut on my finger and the cut heals and everybody raves about it, that's great, and you look like a miracle worker. But if my finger, if it gets chopped off, my finger is not going to grow back. You have to understand this difference. And there's a lot of unscrupulous doctors and unscrupulous quote unquote gurus out there who tend to say things like, yeah, you're on dialysis and I can make you go back to normal. Listen, when we are in trouble, when we are in a place where we're hurting, we're desperate for help and we're desperate for anybody who will give us hope. Hope is really, really powerful, but there's a difference between hope and hype. Number one, if you're able to keep your kidneys stable, yes, your creatinine may not be improving, but it's not getting worse. That in itself is a very powerful statement. Did you know that you are born with 1 million kidney cells in each kidney? And the moment you're born, all that happens is those kidney cells die. So, in other words, over the rest of your entire life, your creatinine is going to get worse, even if you have nothing wrong with you. By definition, just the act of aging, your creatinine is going to get worse. What does that say about every single guru out there that's promising you that they can improve your creatinine? You know what they're saying is, right? They're saying that they can go against the laws of evolution. So be very careful against what people are saying. The fact that you are doing everything, I'm assuming that you are doing all the things that Michelle and I advocate, which means you are sleeping more, you're moving more, you're practicing stress reduction, you're eating mostly plants. If you're doing those wonderful things, you're making sure that if you're getting prescribed medications to lower your blood pressure, you're maintaining your blood pressure in optimal range. If you're doing those things, then we are very, very proud of you and kudos to you for doing that.
Yeah. And the other thing I would say too is, and I've seen this with, I mean, clients I've worked one to one with is it's just kind of the nature of the kidneys too, is like it takes time, like with making diet and even medication changes. These are ideally lifestyle changes and they're not quick miracle fixes. And so being patient and being consistent, tracking your numbers, of course, but it's not something where it's like, okay, I reduced my salt, my protein intake, and started taking this medication. Next time I get labs done in 2, 3 months, it should be better. It maybe it could be, maybe it's the same, but it's look at your trends over time and remember it's over time. Like it takes months to years for lifestyle changes to really come through. So hang in there and remember that. Um, okay, so we have tons of questions. Okay, this is a relevant one. They said, how many grams of protein should I be having stage 3A? My nephrologist says no high protein, but not how much should be eaten. So we do have videos on this. So again, estimating and in general, it's anywhere from about zero point 0.6 to zero point 0.8 grams of protein per kilogram of body weight. This is very important. It's not per pound of body weight, it's per kilogram. So zero point 0.6 to zero point 0.8. Of course, that might need to be a little bit higher, a little bit lower, depending on the person, but that is in general. The other thing to note though is if you are underweight, so your BMI is less than 18.5, then you likely want to use an ideal body weight to calculate your needs. And if you are very overweight or obese, if you use your actual body weight, then you might overestimate your protein needs. And so you want to take that into account, maybe using an adjusted body weight, which of course this is something that a dietitian can help you with. That's a great question because it is hard when it's just like, hey, eat less of this or just don't eat too much protein, but then you're like, what's too much? So this is all right here. I'm going to go to one of the ones submitted before because this one's pretty quick. Are there any herbs or spices to avoid with kidney disease? From my standpoint, in cooking, any herbs and spices that you need to avoid, no. I'd say you want to be mindful of herb or spice blends, like seasoning blends, and see if they have salt or potassium chloride added to them. That's something you might, you can find I don't know, like a Mediterranean blend or a all seasoning without salt and ones with salt. Ideally, you want one that's just the herbs and the spices. You can use fresh herbs or dried herbs, things like basil and mint and cilantro are all great things. Where herbs, you need to be mindful with herbs is more on a supplement side, where something is there's a big difference between using garlic in cooking and taking garlic, a garlic supplement. This was, I think, we'll touch on this because someone asked about turmeric, and like, oh, turmeric is higher in oxalates. So is the benefit of taking turmeric, but then the risk of kidney stones. Again, that's something where turmeric used in cooking, like as a spice or a seasoning, is not going to be extremely high in oxalates. If you take a turmeric supplement, that can be, or like a powder, that can be a very concentrated high source of oxalate. So, and my recommendation would be herbs and spices, use them in cooking because those are appropriate amounts, and then don't take any herbal supplement unless you talk with your doctor or renal dietitian to get individualized advice. Do you want to add anything to
Yeah.
that, Josh?
Yeah, so this is a really important topic, guys, because when you take a supplement, oftentimes what they'll end up saying is things like proprietary blend, so you don't know what's in there. So I'll put the link to this study, but there's a study from Food Chemistry and Toxicology from 2017, and this is a really important study because what they basically did was they looked at everything that was published inside PubMed over the last 50 plus years, and what they ended up finding was that there were approximately 7 herbs. Now, out of those 7, they ended up looking at, in addition to that, they found 10 dietary supplements. And what they found was those 7 herbs and 10 dietary supplements were linked to kidney injury case reports that were published. Now, some of those things were Chinese yew extract, impala, morning cypress, St. John's wort, thunder god vine, let's see, tribulus, wormwood, and a bunch of other things. Why does this matter to all of you guys? Is because oftentimes when you get products, especially when you get products claiming to be kidney cleanses, liver cleanses, you have to be very mindful because they will contain either an herb or a concoction of herbs, and you don't know. The other thing to be very mindful is not just talking specifically about herbs. It's the fact that oftentimes when the products are manufactured and they come in a bottle, so it's one thing to talk about you're getting actual turmeric and cooking with it. It's another thing when you're talking about getting capsules. What happens is oftentimes when they're manufacturing, the conveyor belt itself on which they're making it, you can get things like lead, mercury, cadmium, arsenic, or heavy metals that can come inside the capsules. And then, not to make matters worse, but let's make matters worse. So to make matters worse, what ends up happening is sometimes when people end up saying that they are testing the products. They will test the contents of the products, but not the capsule itself. So the capsule may have been made in China. Now, there's a couple of manufacturers, for example, that will state things like made in America. What happens is they make the products in America, then they actually import out to overseas where the capsules are made. They get packaged in there and then sent back over, but they're still branded as made in America. So there's all sorts of things that get done. And as a result of it, this whole concept of herbs and this whole concept of dietary supplements ends up being far trickier than you actually want to know about. And unfortunately, most of the adverse reactions are not reported. So therefore, if we say that, there's no reported cases of anything happening with X, how do you know that that means that this substance is not harmful? And versus, we just haven't reported it. Do you know how much work it takes to actually report something? In other words, I have a busy practice. Before Michelle and I got on this, I was telling Michelle I was in clinic all day. I rushed over. I haven't changed yet. I didn't drink water all day. I was so tired. I didn't even go pee. So I ran over. I peed. I'm still so thirsty. I'm drinking water like crazy. And so if I want to publish a report, it takes a lot of work. So please keep in mind that a lot of this stuff is underreported. And whenever you see a label that seems like it's too good to be true, trust me, it probably is too good to be true. And you can always come and ask us. We really don't have any skin in the game. The stuff that we end up recommending is the stuff you can find anywhere. So when we talk about things like B complex, we talk about things like vitamin D. This is not some magical proprietary stuff. This is stuff that you can find just about anywhere. And we have so much data to be able to support what we're saying.
Yeah. All right. Question on non-dairy ice creams. Things made like non-dairy ice cream, but made with like oat milk instead. I mean, basically my thing is one, you always want to check anything that's a non-dairy product for phosphorus additives in the ingredient list because oftentimes they will have that. It's still a sweet treat, I would say. It's something that they're still going to put a bunch of sugar in it to make it taste good. I would just utilize it as it's a sweet treat, just like ice cream is. It's not this like necessarily better thing. It might have higher or lower potassium or phosphorus depending on the other ingredients of it. So I think it's something that can be utilized as a sweet treat, but it's not this like, hey, it's not actual dairy ice cream, so it's good for me sort of thing. Anything you want to add to that, Dr. Hashmi?
No, no, it's an interesting topic. I think we all have a sweet tooth. The one thing I will tell you, the one thing that I'm really, really worried about with the kidney patients is what I call non-nutritive sweeteners. This is a fancy word that I use, and I think it's too complicated, but let me tell you the buzzword in the kidney community is this thing called stevia. So, for some strange reason, all my kidney patients are so excited about stevia and monk fruit. And God forbid, if I say something against stevia, it's like I have insulted their firstborn, and people get so offended. So, just so that I sent the record straight for all of you guys listening today and watching this video later, it's not like, I have stock or I'm shorting the stock against stevia or Splenda or erythritol or xylitol or any one of those guys or Nutraseed. But here's the dilemma, especially for kidney patients and why you should care, is what the data shows for all of you guys is when you take these things are anywhere between 200 to 600 times sweeter than sugar. So when people are trying to improve their kidney function by improving their sugars, and they're hoping that they can improve their sugars by trying to eat these things that are zero calorie sweeteners, what they don't realize is these zero calorie sweeteners, they create what's known as this leaky gut. They allow more calories to be absorbed in their intestine. They actually create insulin resistance. They cause you to have more sugar floating around your bloodstream. They stimulate your appetite more, so you get hungrier. And overall, they make you gain weight, which leads to a vicious cycle because the more weight you gain, the more insulin resistance you gain, which leads to more weight gain. As a result, your diabetes gets worse. As a result, you put more pressure on your kidneys. As a result, your kidney cells start to die faster. So, what's the bottom line here? As you look at these products and you say, I am doing such a great job because I gave up sugary foods and I'm going with these things that say 0 calories, but they taste sweet. Just remember, once again, if something tastes so good or it's too good to be true, there's a reason why. So, that's my warning. I know I'm a bad person for saying it, but I will keep saying it over and over and over again.
Yeah. And we have a whole episode that we had just put out on sugar. So, and that's some of the comments we got. That's what you're addressing there. So, all right, let's see. Okay, someone says they're on trial for an IgA nephropathy or drug for IgA nephropathy. They're also on Jardians. Do they still need to restrict their protein intake? They're non-diabetic, blood pressure 135 over 85.
135 over
85.
85. Got it.
So they're
Got it. So,
asking basically, do they still need to be restricting protein intake if they're on Jardians and this trial medication for IgA nephropathy?
oh, 100% yes. Yes, 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 absolutely. So keep in mind, the beauty of Jardians is for those of you guys know, Jardians is essentially a new class of drugs. They're sodium glucose co-transporters. And what they end up doing is we quite don't fully understand the mechanisms, but they're great in terms of improving A1Cs. They kind of make you spill some of the sugar out. They lower the protein in the urine. They're starting to become standard of care in any kidney disease going on where there's protein spillage. They're good for cardiovascular protection. They cause a little bit of weight loss going on. So there's other benefits as far as those goes. So they're great. The downside to them is they can lead to some nasty urine infection and fungal infections down there. So you do need to be very cautious when you end up using them. So it's not like they don't have risk and they have other side effects as well. But when you're on them, you remember just because you're on a drug, you can't forget the basics. The basics of kidney disease are still the same. You still want to make sure the top three things, which is weight, which is blood pressure, which is diabetes. And for blood pressure, you really want to have that top number to be more in the 120s, preferably less than 120 if possible. The bottom number less than 80 if possible. That's ideal. You want the sugars to be as good as possible. You want that weight to be as good as possible. And If you're spilling protein, protein restriction is still going to be very helpful for the type of protein, predominantly plant-based. Plant-based protein is going to be the ideal source. Remember, the data that we presented in the past has shown that of all the types of plant-based proteins, we found that soy was one of the best types of plant-based proteins you could ideally be using. So that's still going to be the ideal option. So it's not medications or it's medications and protein restriction, exercise, and everything else.
Yep. And since you kind of brought up that the blood pressure goals and targets, one of the questions we were asked about was someone is on lisinopril, their blood pressure ranges in the high, they're usually 80s or sorry, high 90s over about 69 to 73. And so their question is, do I need to stop taking this blood pressure medication because like one, is that too low and damaging their kidneys because it's too low? And then two, do they need to stop taking that blood pressure medication or should they then add more salt to their diet?
Yeah, how much is the lisinopril? What's the dosing?
That was, I think it looks like it was kind of confusing how it was worded, but 2.5.
2.5. So 2.5 is
Mhm.
an extremely low dose. So remember, guys, we can't give you individual advice. I can tell you in my own patients, sometimes, so 2.5 really does nothing for blood pressure. It's very, very low. But there are patients who even 2.5 might just be doing something. But sometimes it's given for other reasons. For example, that 2.5 might just be enough to have just a little bit of kidney protection or other stuff. But here's the bottom line. If you have anything going on as far as you stand up, you're dizzy, or you have a risk of fall, or anything like that, this is a really important thing that you need to tell your doctor immediately about. Remember, at the end of the day, the decision that's made is never just black and white. This is why when sometimes I hear people on YouTube or TikTok or Instagram or anybody, some doctor goes out there and says, "Oh, that's terrible. I can't believe your doctor said that." And I sit back and I say, "But you don't know the whole history. You don't understand the dynamics. There are all these dynamics that go into this doctor patient relationship. And this is why you need to understand all of those things before you make a judgment call. So it's not to say it's a cop out, it's to say that you really want to look at all of those details. There may be a very specific reason. That's a very low blood pressure. It's also a very low dose. If you're having symptoms, please don't wait. You want to talk to your doctor immediately about it. Say, look, this is my blood pressure. If you're getting up, you're feeling dizzy or lightheaded. We don't want you to fall down. God forbid you hit your head, you get a bleed in the head. That's a very serious and dangerous thing.
Yeah. And I think that's the symptoms. Are there symptoms associated with your blood pressure is important too. And then as far as like adding salt to your diet, I mean, I would say it's very, most people aren't consuming so low sodium unless they're like literally cooking everything at home. They're not using seasoning, spices, dressings, anything like somewhat processed condiments and stuff, breads, all these foods have salt. So most people aren't following like this extremely low salt diet where it's like less than 500 milligrams a day. But maybe this person, like that's the case, and they're like only eating everything from scratch and not adding anything to it. And then, I would just say track and see what you're eating for a day and how much sodium you're actually having. Maybe it's medication, maybe there's some adjustments to your diet. But most people aren't eating extremely low sodium
Mm.
diets.
And keep in mind, we deal with patients who have pulmonary hypertension, where in fact their blood pressures run low to begin with. We keep them on an ACE inhibitor. We would never give them extra salt because it's not an issue that they don't have salt in their body. It's the fact that their pump cannot squeeze fluid forward. So in other words, once again, this is very, very complex. Just because your blood pressure is low doesn't mean you need to put salt in. What if your issue has nothing to do with the fact that it's a salt issue, that your blood vessels are already stiff, but it's that the pump cannot squeeze stuff forward? And now you're just going to make the situation worse by trying to add salt. So if you don't know, please, these are the kind of things you want to definitely sit down with your doctor and ask.
Yeah. All right, next question. You guys have lots of questions and lots of great questions. Okay, this one it says, is intermittent fasting okay for someone with mild proteinuria, normal labs? We have an entire episode on this. So I don't know if you want to like give any brief points on it. I don't think we want to explain everything with intermittent fasting because we do have a longer episode on that people can check out.
Yeah, so remember when we talk about things like intermittent fasting, it's not that intermittent fasting directly links to protein in the urine. When we do the episode on intermittent fasting, the benefits of intermittent fasting have to do with things like your overall blood pressure. They have to do with things like your overall sugar control. As you improve those things help to take the pressure off of your kidneys and the other organs, which then relay to taking pressure off things like protein in the urine. So, can intermittent fasting indirectly help those markers? The answer is yes. Is intermittent fasting by itself miraculous? The answer is absolutely not. So if you think that you can just do intermittent fasting, for example, some of the things that people always talk about is, well, what if I just eat one meal a day? Right. And if I just do that, am I perfect? Well, no, you're not perfect. Your mother might think you're perfect, but other people might disagree. The point is anytime we think that just because a little bit is good, extreme might not be good. In fact, you might get negative results because now you're creating insulin resistance. You might be micro or even macronutrient deficient. So just because a little bit is good, too much may not be good. So intermittent fasting is good. Too much or too little is not necessarily great.
Got it. Okay, this is actually a good question for us to get to because it was asked ahead of time and then I saw it pop up on one of the comments. But they're asking about can people consume amino acid supplements, specifically either plant amino acid supplements or like branch chain amino acid supplements or essential amino acid supplements. And they said whether, especially if they're an athlete or even if they're not. You want to touch on that, and then I'll go into that a little.
Okay, so this is a really interesting and tricky question, and the reason I bring that up is because prior to the studies that were done in 2019, there wasn't a lot of data as far as this is concerned. So in 2019, there's a really interesting study. This is a study where the title of the study is Differential Impact of Dietary Branched Chain and Aromatic Amino Acids on Chronic Kidney Disease Progression in Rats. And essentially, what they basically alluded to was the idea that branched chain amino acids interfered with kidney function. They decreased glomerular filtration rate, they stimulated kidney fibrosis, and they led to worsening of overall kidney function. And so the idea there is that a lot of people thought that they could just use branched chain amino acids sort of indiscriminately without having to worry about it because you weren't taking the overall protein profile. And it turns out that's not necessarily the case. So when we talk about protein restriction, sometimes what people end up doing is instead of being able to consume the same amount of protein they did, they will supplement a little with branched chain amino acids. That's still better than consuming the previous. So if you were taking 1.2, 1.4 grams of protein, per kilogram of body weight previously, and now you're going to zero point 0.6, zero point 0.8, and let's say that, you're at a place where you feel like you needed more and you're an athlete, and instead of going back to your old protein days, you're taking BCAAs, that's a better option than going back to 1.2, 1.4. But what we don't know is what is that impact going to be in humans as far as the role of fibrosis goes. This is really important. The thing about BCAAs and the thing about protein in general is protein does cause things like increase in afferent vasodilation. What's afferent? That's the blood flow that's going to the kidney. So essentially what happens is you have more pressure going inside the kidney, and as a result of it, that pressure leads to scarring over time inside the kidney. The whole idea of decreasing protein into our bodies is that there's less protein that's being then filtered by the kidney. That's all it is. All we're trying to do is reduce the net amount. So how much branching amino acids could you take in humans? I don't know because it's very hard to study that. The only data I have is done in animal models. So in other words, if you're taking, 1 or 2 grams, is that a big deal? No, not really. Because when we're talking about the actual protein supplementation, when you calculate it out, that's a lot of protein. We're talking 60 grams or so. So if you're taking a few grams of branchin, I don't think that's going to be that big of a deal. But just keep in mind that it's not like it's a free lunch just because you're taking BCAAs.
Yeah. And there are for people with, and these are some of the questions popping up too, but there are things called keto analogs or keto acid. Those are kidney specific amino acid supplements that are used sometimes in later stages, usually stage 4, stage 5 kidney disease, with a very low protein diet. And so this is something that I think 100% should be guided by a renal dietitian and your nephrologist on board. It's something that can be useful, it allows someone to go, let's say they have 13% kidney function. It allows them to go very low in protein. But these keto analogs, Ketorina or Albutrix are the ones that they have in the United States. But those are replacing, basically, they don't have the nitrogen component like normal amino acid supplements have. And so that is why they're used specifically for people with kidney disease. And then it's to kind of make up for that amount of protein that they're not getting in their diet. So again, people in usually in earlier stages of kidney disease, it's not something that is indicated to use because they don't need to be as restricted in their diet. But it's something that definitely, I've had clients that I've used it with in those later stages with a much lower protein diet. All right, let's get to our next question. So many, so many. Someone, if you just briefly want to answer this one, Dr. Hashmi, someone wants to know how they can consult with you and work with you. They're in Canada, but if you want to answer that in general.
I try to do these things live because of my work and so forth. I'm not allowed to do private consultations, so I apologize for that. And I try to do the best I can in terms of answering. I do have to tell you guys, it's pretty difficult. I get, gosh, about 60, 70 messages a day through the social media channel. So it's been quite maddening to try to keep up. So my apologies to all of you guys if I've not applied or so forth. It's not because I didn't mean to dismiss or anything like that. It's just insane. I've never had so many questions my way and not be able to answer in a timely fashion. So my apologies. But I will tell you if you have questions, I can answer them generically so that I can help you in any way and guide you in any way. I've been on the other side where when I was very poor and very difficult to find help. I know what it's like. So if you're suffering and if there's anything I can do to help, I will absolutely do whatever I can to support anybody I can in any way I can. So that will always be the case. And that's part of the reason why I do what I do.
Yeah. And that's why, it's so beneficial that you are able to set aside this time to come on this channel because it's such a great resource for everyone. Okay, lots of questions on protein in the urine. If let's kind of answer a couple of these together. One is they're asking what are things that they should eat or shouldn't eat if they have protein in their urine, and to reduce the protein in the urine, should they not eat protein foods? So I guess in general, for to kind of answer that second part, is you still need protein. So you can't eat and not get any protein. Like it would be really hard to not get any protein at all. But no, you still need protein. Those amino acids are still important. It's just with protein in the urine and with kidney disease, especially stage 3 through 5, then lower protein diet is what's recommended. And they gave those guidelines earlier. It's about zero point 0.6 to zero point 0.8 grams per kilogram. You'll see, and if you estimate that for yourself, it's a lower protein, but you still need to be eating protein even if you have protein leaking in your urine. But that is where whole food, minimally processed plant proteins are going to be more beneficial for people compared to the animal proteins as far as their kidney health and reducing protein in the urine. Anything for that, Dr. Hashmi?
Not on that one, no.
Okay. Uh, this person said, what about taking MSM and glucosamine for their knee pain? I honestly don't. I would have to look into that. I don't know the research on that.
So it's funny. I have knee pain, and for the longest time, I was such a big fan, and I kept hoping that this stuff would work and so forth. So, so I took glucosamine for the longest time and MSM, and the problem with all of the studies are the ones that show that it works were usually either conflict of interest or were funded by somebody, either the manufacturer themselves or somebody like that. So half the studies out there showed that they worked, and the other half showed that they didn't work. And the benefit was very little. So I actually don't use it because I haven't found enough benefit as far as that goes to be able to make it worth my time. That's number one. Number two is the stuff that I have found that does make a difference are good old, very basic things such as turmeric, such as fish oil. Those aren't anything miraculous. They take time, but they do work. Overall, things that make a difference over the long term, not the short terms, are things like getting rid of inflammatory foods, which, of course, once again, are the things that are the most acidic. So, all of the guys out there who are big proponents of carnivore diet, unfortunately, those are very inflammatory. Look, when you're in your 20s and 30s, a lot of people think they're invincible and they can do whatever the heck they want. As they get older, they realize you got this one body, and a lot of the things you end up doing, they kind of, they hurt, and you kind of have to start recovering from. So this is where it becomes tricky. So as far as stuff goes, is unfortunately I can't recommend it. I just don't have enough solid evidence to say that your hard-earned money makes sense to go spend it on that. But the basics, such as a good old vitamin D3 supplement with K2, fish oil, all of those things, turmeric, those are still the tried and true and the basics. More plant-based foods, those are still going to be great. And don't forget the power of good old stretching and yoga. Yoga is phenomenal. I was one of those naysayers. I am the most inflexible person you will meet. And I tell you, yoga, and with yoga, you don't have to do a full-on yoga thing. You don't even have to do one of those Peloton 10-minute things. What I do is every time I finish my workout in the morning, I just do a few poses. That's it. I make it a point every single morning to do just a few things. And it makes such a difference in how your posture is throughout the day, in how your breathing is throughout the day, and how your joints feel throughout the day. So if you're having those issues, start to think about how your alignment is too. You'll be surprised how your knees are connected to your ankles, how they're connected to your hips, how they're connected to your spine. So don't forget just the power of mobility instead of relying on things like a supplement to make you feel better.
Yeah. All right. Someone wants to clarify earlier when you said about soy protein being the best plant protein, and then there was a question about soy protein and oxalate content. So we'll get into that too. So the thing you were talking about earlier on soy protein for as the best protein.
Yeah, so when we were talking about as far as the data goes in terms of which one was the protein, as far as in terms of kidney protective of all of the proteins that were available, soy had the best data for being the most kidney protective. So if you had to pick a protein, which one would you pick? You should pick soy. And you should always pick organic soy, but you should pick soy.
Yeah, and that's something that it wasn't it's not a study looking at soy, like soy protein versus beans versus lentils versus whole grains, nuts, and seeds. It was looking at meat and poultry and fish and soy. It was in that context of that. And as far as soy go, yes, soy is higher in oxalates. And the person was asking about like kidney stone formers, it is very important to know your urine, your 24 urinalysis, and if your urine oxalate level is high or not. A lot of times people get very focused on oxalate from foods and following a low oxalate diet, and they restrict foods that are actually beneficial for reducing kidney stone formation because they get hyper focused and they don't even have high urine oxalate levels. So, one, it's important to know your 24-hour urinalysis and those oxalate levels in your urine. And then, usually, for a lot of people with calcium oxalate stones, if they avoid the extremely high oxalate foods like spinach, for example, and choose a different leafy green, usually that's enough to help lower their urine oxalate levels. If not, then yes, soy is something that is going to be higher in oxalates. But there's always ways. I mean, again, I think we think of things like tofu, right? They make pump food now. They make all alternatives. I've seen recipes where you can make tofu out of chickpeas. So there's lots of alternatives too if it's something where you can't have soy or
Right. But remember, guys, if you have calcium oxalate stones and you're worried about the oxalate in your diet, I think you're missing like 80 to 90% of what causes stones in the first place. Right? So if you're worried about oxalate, you missed everything that I've talked about. So the 80% of what prevents stones from happening is water. Stones cannot happen in a river. In order for stones to happen, debris has to stick together. So, number one, this is why the very first thing we opened up with was a urologist saying, you got to drink 3 liters of water. When we do a 24-hour urine collection, the first thing we tell our patient is not, oh my God, you have more oxalate. The first thing we tell our patient is, oh my God, you still don't drink enough water. That's number one. Number two is if you got calcium oxalate stone, the second thing we start to talk about is citrate or the acidity of the urine. And the acidity of the urine also matters a lot because we can fix that by the quality of your foods. What does that mean? Is the more acidic foods that you're eating, the more acidic urine that you're making, the more likely you are to have a stone forming environment. And the third thing is if you want to prevent oxalate in your urine, you need foods that are rich in calcium. Why do you care? Because if you have foods rich in calcium, the calcium is going to bind to the oxalate in your gut and you're going to poop it out. So it's very, very important. It's completely contradictory. When you're talking about a person who's a calcium oxalate stone former, you tell them to eat foods that are rich in calcium because what it ends up doing is the calcium in their gut will bind to the oxalate, and as a result, they can't absorb it. It precipitates and then it ends up going out through their bowels. And when you go to the bathroom, you end up getting rid of it.
Yep. And that brings us then into the next question that we have is they are saying, is it safer to eat food with added calcium like tofu or a nut milk than it is to take calcium supplements in order to meet their daily requirements if they're not having dairy? Or is that equally, because usually it's not recommended to get the calcium from calcium supplements because that can increase your calcium levels. But is that the same then for foods that are fortified with calcium?
Yeah, in general, you'll always be better off with foods that are either fortified or already have calcium. Always. That's always a better option because of the fact that you're getting food with it. If you're just taking calcium by itself, then the amount of absorption without giving it time to mix with the oxalate, the whole concept of food and the calcium mixed in with the rest of the food is it has to spend more time. And as it spends more time in your GI tract, that's more time for it to bind to the oxalate in the GI tract. Versus if you're just taking calcium by itself, it's got a direct one-way road to get absorbed. That's all.
Yeah. Okay, let's see. Okay, answered
That's a
that.
lot of questions, Michelle.
Yeah,
That's a
there's a
lot
ton
of
on here.
questions.
I'm
My
gonna go through
goodness.
them. A couple people asked, and I think we're planning to do an episode on this, so I'm just gonna say stay tuned about like cordyceps and mushrooms
Yeah, yeah.
because we got to go more into the research on that. Um, CBD. I mean, is it
Yeah,
okay to CBD, CBD
CBD
oil?
CBD is very interesting in CBD oil. As you know, with CBD, there's a lot of data in terms of where the benefits can happen. Some of the data, especially around seizures, around migraines, and so forth, not so much as far as kidney disease and kidney disease sufferers go. I think some of the challenges that people do run into is the fact that if you end up consuming it and your appetite starts to go up, it's a vicious cycle. Once again, the challenge that you have with kidney disease is anything that's going to stimulate your appetite. Unfortunately, anything that drives the machinery is going to make the kidneys die sooner. So we are in this really weird cycle where the less you weigh, the less the kidney has to filter, the longer that each one of those kidney cells are going to live. Some of the statistics you might have heard Michelle and I mention before is, when we first started doing these series, we were talking about things like, you can lose as much as 40% of your kidneys before your GFR ever starts to notice a change. Or in other words, before your creatinine ever rises, you could have lost as much as 40% of your kidneys. The rest of your kidney cells are working harder to make up for the kidney cells that you've lost. So this is why when we talk about extra weight and all this stuff, even if your kidney function is normal, don't make the mistake of thinking everything is okay and I'm carrying around that weight. We have this thing, and so as you guys know, I'm a kidney specialist and an obesity medicine specialist. So I do two specialties. And in Southern California, I run one of the largest weight loss programs essentially in the country. And what we talk about is this idea that we're not sure anymore that there is such a thing as a metabolically healthy overweight. We can see that the numbers are okay, but where we don't know is what about the pressure on the organs, specifically when it happens as the pressure on the kidneys. So, what I would encourage you is not that you have to get an ideal BMI, because BMI is a very flawed marker, but that you always want to make sure is that you're focusing on the idea of trying to be healthy with doing the concept that Michelle and I keep repeating like a broken record, because we're not asking you to be an ideal weight. What we're asking you to just focus on trying to incorporate the principles of health. The principles of health. That's all we're asking for.
All right, question on magnesium supplements. We do have a whole episode on this, but they said that they are stage 3B. They were told not to take a magnesium supplement by their doctor, even though their magnesium blood levels are normal. Any thoughts on that?
Wait, sorry. So they were told, I was trying to
They
look
were
at the
told not to supplement magnesium, but their blood levels of magnesium are normal. So,
okay.
any, I guess, guidance on that?
So if your magnesium levels are normal or not, magnesium, there's 10 different types of magnesium. And we'll try to either create a handout or something for you guys so you can see. There are so many different types of magnesium. Some are great in terms of constipation, meaning they're predominantly in the GI tract and they don't really get absorbed. Things like magnesium oxide, for example, etc. Some are the ones that are very good for sleep. For example, magnesium glycinate. So myself, I have migraines, really bad migraines. And so for me, what ends up happening is I take magnesium glycinate every evening because it helps me to sleep better. For some people, they find that in terms of being able to think better and so forth, they take magnesium threonate because magnesium threonate crosses the blood-brain barrier better than most of the other magnesium brands. So they can take the threonate version, which allows them to get directly into the brain. So magnesium is a number of different types. So it's magnesium plus the molecule, the carrier molecule determines where it's going to end up going. That's number one. Number two is it depends on why you're taking the magnesium. If you're just taking the magnesium because somebody just told you to take the magnesium, then yeah, probably don't take the magnesium. But you got to figure out what's the underlying cause. Are you taking it for constipation? Do you have kidney disease and somebody's worried that you might get MAC toxicity? MAC toxicity is very, very difficult to get. That's number one. Number two is, are they worried that you're going to get severe diarrhea and get some crazy electrolyte derangement? Is that why they're worried that you shouldn't take it? So sometimes when somebody says, don't take it, the next question should be is, I get it. And my next question is, what are you worried about and why shouldn't I? That's a really important follow-up question because you want to know why they're worried about it for you.
Perfect. Okay, another question we had was they have low red blood cell count but high B12. And they were reading that you need B12 to increase your red blood cell, but how do they lower the B12 but also bring the red blood cell count up?
Well, it's not that simple. Okay. So let's back up. So they have a low red blood cell count, right? That's the first thing. Okay, so if you have a low red blood cell count, you have to understand just because you have a low red blood cell count, it doesn't mean it's just because of B12. There are so many causes. For example, Your B12 might be fine, but you're iron deficient. That's one of it. Maybe you have something known as thalassemia. That's what's causing it. Maybe you have some sort of chronic stuff going on. It's not just iron deficiency, but you have some chronic inflammation that you don't know about. Maybe you have an underlying infection, or you have something going on in your liver going on. For example, a lot of our alcoholics, they have always just anemia. And part of it is when they stop drinking their alcohol, everything gets better. Or what if you have hypothyroidism? If you have hypothyroidism, you're going to find that you're anemic. The treatment is not B12. Your B12 could be normal, or you've been supplementing with B12 like crazy, but because you're hypothyroid, your anemia never gets better. So keep in mind, just because you are anemic, it doesn't mean that it's just B12. There are so many causes. So the first thing we do is we look at something known as mean corpuscular volume, or MCV. We divide it into three categories. It's MCV less than 80, is MCV 80 to 100, and is MCV greater than 100. And in each one of those categories, we have what we call a differential diagnosis. We look at it, and that's where we start to think. Then we also look at the red blood cells under a microscope to see what the shape of them is. That gives us an idea. And based on those two things, we also then start to do further tests. For example, we may have to look at your TSH or your thyroid levels to see what's going on. Sometimes we even have to do a bone marrow or something else to figure out what might be going on. So there are so many things. Now, in terms of B12, if your B12 is high, you don't have to worry about it. It is water soluble, which means you pee it out. So if it's high, it'll go down. Not a big deal.
Yep. All right, let's see in here. We have so many. And again, if we don't get to all these, we are going to be doing this monthly. And a lot of the questions being asked, we do have episodes on them. So, um, someone wants to know, well, can losartan raise their blood potassium level?
Yes.
Right. How do we feel about 100% dark chocolate? It's 0 grams of sugar, potassium's less than 200 milligrams per serving, no phosphates or artificial sweeteners.
Actually, let me take that back. It's only good if you share it with Michelle and I. That would be my take on it. Michelle, I don't know what your take is.
Yeah, I mean, 100% dark chocolate. I say usually for the you want ideally the cacao can be over 75% is the goal. Um, and with minimal added sugar in it. And remember, it's a good sweet treat and it will have more phosphorus and a little more potassium than a milk chocolate or a white chocolate, but that's because it has more cacao in it. And I think even on low potassium diets, low phosphorus diets, people can usually still fit it in. It's just the portion of it. So all right. Fine. Someone had asked, what are some good snacks for people with kidney disease? I feel like or I can do an episode on this. Of course, for me, I'm always like, you want to get fruits and veggies in somehow. So, can you do an apple with a nut butter? Can you do some hummus with some veggie slices? Even if you have some crackers with it, get the veggies in with it too. Popcorn that you've popped, ideally, that's lower in sodium, can be a good option. There's whether it's a plant yogurt or yogurt type of thing, where you do walnuts and some berries, maybe some ground flaxseed. I mean, ultimately, there's lots of snacks you just want to be filling and satisfying. Ideally, get in some fruits and veggies with it. But anything snack wise, Dr. Hashmi, that you recommend?
No, no, I'm just blown away at how many questions there are. I was finally able to pull up the questions right here. Wow, there's a lot of questions.
Yeah, and a very wide range. One of
Yes.
the questions that someone asked, and it was kind of, um, can they eat more vegetable protein than animal protein? Or can I forget protein in general if I only eat plant-based? So, I kind of think this question is being phrased as, and this might be the last question we get to tonight, but like, if you're eating plant-based protein, doesn't matter if your protein intake overall is high or you're meeting that zero point 0.6 to zero point 0.8. Does the quantity matter if it's plant protein? So yes, both quantity and quality do matter. Generally, it is easier for people to follow that lower protein diet when they're having more of the plant proteins because they're not as, or a lot of them are not as high or as concentrated sources um, as the animal protein. But I'd say yes, if it's between a very excessively high protein diet that's coming from whole food plant based versus animal, then definitely better the plant based. But it's better to be within your recommended protein guidelines with more of that protein coming from the plant protein than it is to be way outside, way high, even if it is plant protein. Anything you want to add to that?
Mm-mm. No.
Okay. Another thing too that someone had asked, and I'm just gonna say this one last thing, is they're like, is it really necessary to avoid animal protein or can you just do it in moderation? And my thing with that, and Dr. Hashmi and I have always said it's, we always say it's about progress, not perfection. It is not something that needs to be an all or nothing mentality. Like that's the last thing that we want is people to think like I have to be 100% plant based or I can't do this at all. Whether someone's 100% plant based, 75% plant based, or they 2% and they just start adding in more veggies into their diet. All of those are things that are going to be beneficial and helpful for them and their kidney health. From the standpoint of moderation, I just think it's important for people to actually like define what that means for you because oftentimes what we think we're like, oh, I'm just eating less of this or I'm doing this in moderation. But if you actually look at your day or your diet as a whole, it might not actually be in moderation. And animal protein does add up very quickly. So if someone is a later stage and on a lower protein diet, let's say it's 40, 45 grams a day is their goal, that's 10 to 15 grams a meal. If you ate a piece of chicken this big, 3 ounces, that's already 21 grams of protein, not including the grain, the veggie, the starch, whatever else you had with it. So it's just something, no, it doesn't mean it has to be 100%. But when you say moderation, really define what that moderation is and look at your intake. Anything you want to add to that, Dr. Hashmi?
No, no, just, just in closing, guys, I mean, this is well beyond our wildest imagination. Thank you so much for your trust in all of us. Look, Michelle and I, we're just two people. We're trying to do our best to help you. We make mistakes. By no means this should replace your doctor, your dietitian, your care team. I know some of you guys have asked very specific questions. I've seen someone ask about PLA2R. If you have PLA2R positive, for example, you require immunosuppression. These are the kind of things where you don't want to wait. You want to make sure that you're talking to your nephrologist. Also, remember, if you're talking to your doctor and you're not getting the answers you want, it's okay to seek out a second opinion. That's perfectly all right. This is your body. You want to make sure you feel comfortable with your team. With us, we try to give you general answers. We're trying to do the best we can. Both Michelle and I, our goal is once again, can we create a place where we can help you to ask the right question, where we can be your advocates? By no means we're trying to take anything away, but once again, if we have helped you, just please give us a thumbs up, leave something kind. If we haven't, we apologize. We're trying to do the best we can. We make mistakes. We're only human, but we are very, very grateful for you spending this evening, this hour with us. I know you could have gone and seen people who look much better than us, probably talk better than us, and all that good stuff. But even then, we're very grateful.
Yeah. And we will see you guys live next month. And again, we have tons and tons of videos on our channel. Check it out. Over 100 videos, a lot of them addressing questions that you guys have asked, where we can dive deeper into that. So we will see you all next month and then on our channel. Thanks for tuning in, everyone.
Thank you, guys.
Bye.